Vaping is making headlines in recent weeks, with the state of Michigan being the first in the country to ban flavored vaping products. Vaping has emerged as a new public health concern. The 2019 Munson Healthcare Community Health Needs Assessment, which takes a close look at issues impacting the five-county region, shows that while the youth rate of cigarette smoking has significantly declined, vaping nicotine is on the rise. This is just one example of how vaping is causing increasing concern for parents, caregivers, and our medical community. I'm Dr. Christine Nefcy. As a pediatrician and a parent, I want to help you start the conversation with your children about the dangers of vaping in this month's Your Health Matters. Let's start with the basics. What is vaping?
The point we try to make when we talk about kids and vaping is that vaping is not a vapor. Vaping is an aerosol. So what happens is there's a liquid that is burned. It creates toxic chemicals. It has flavors in it that are chemicals. It makes an aerosol, and kids and adults inhale that aerosol directly into their lungs.
We've been hearing a lot on the news about kids having lung injury and even some deaths across the nation. What exactly do we know about the safety?
Well, that's one of the scariest things is we have so many kids, over 20% of our teenagers are vaping now. And it is an incredibly addictive product, and we do not know the future. There's a lack of regulation, there's a lack of knowledge, there's a lack of knowing of the safety issues, and it's incredibly addictive.
I'd say most parents probably wouldn't even recognize, some of the tools that they use if they saw them.
That's correct. This is the Juul here, and it looks just like a flash drive, and this part just sticks in to charge, so you charge it that way into your computer, and then that's a little motor. You put the little pod in that has the nicotine in it, and you can do it this way. You can stick it in your pocket. You can hold it in your hand. What
advice do you have for parents on how to talk to their children about the dangers of vaping? I know when I was a pediatrician, I always told my parents to say, ask them what their friends are doing, because often they'll tell you what their friends are doing. Absolutely. But if their friends are doing stuff, you should probably lead and have the conversation about what they're doing.
Talk to them very early. Don't wait till they're 15 years old. Talk to them when they're 5 years old. Don't hesitate. Talk frequently. Realize that there's one of their friends, then that's a very high risk for the kid to be doing it too. So,
we have more information, resources, and support guides for parents on vaping, including a video that shows parents what vaping products to be aware of. You can find that information on our Your Health Matters page at upnorthlive.com.